All right, welcome everyone to our Bold Public Health Center of Excellence on Dementia Caregiving webinar, Mobilizing Local Partners, How Public Health is Driving CMS Guide Model Success. Thank you. Next slide, please, Ashley. I'm Joe Gogler. I direct the Bold Public Health Center of Excellence on Dementia Caregiving. Work closely with our two Excellence Center coordinators, Ashley Millenbaugh and Elma Johnson. And we're very excited for this webinar today. It's a follow-up to what was a very exciting webinar that we had hosted back in December when we first introduced Guiding an Improved Dementia Experience Model to public health departments. And today we're going to follow up on that webinar and take stock of how public health in particular has evolved in the context of Guide, has collaborated with various Guide providers in specific states. And we certainly hope this is an opportunity for all of you to share some of your experiences, either in terms of what you know about Guide, perhaps some of you has used Guide, or some of you may have partnered with Guide providers, or perhaps you're Guide providers yourselves. We really want to think about how public health can play a key role in sharing the word about Guide, connecting people who could benefit from Guide, and learn more about what we think is a very exciting model. Next slide, please, Ashley. Um, we'll we always like to begin with a very important land acknowledgement. The University of Minnesota Twin Cities is located on traditional, ancestral, and contemporary lands of Indigenous people. We acknowledge with gratitude the land itself and the people. We take to heart and commit through action to learn and honor the traditional cultural Dakota values: courage, wisdom, respect, and generosity. Before we get a little bit into the center, I wanted to return to this webinar itself and really what its intentions are. Again, this is not only for current Guide partners and health departments, but again, many of you in the audience who might be aging service providers, maybe you're not as aware of Guide or are not participating in any types of collaborations with Guide providers. We hope you see after this webinar, you see a potential role for yourself in Guide. And again, that perhaps you'll reach out to members of your community or other partners with a Guide system in your community to find out how you can learn more and again, advance this very exciting model. As part of another initiative I lead, which is called the State Alzheimer's Research Support Center. This is a large National Institute on Aging center that's really designed to support states and sub-state entities build their dementia care data infrastructure to better understand how integrated and coordinated dementia care services are working in their states and communities. And we just had published a paper that Elma will put in the chat called the Characteristics of Sites Delivering the Guiding and Improved Dementia Experience Model. And really, the take-home points from this paper is that there's a limited public awareness of Guide, as well as limited opportunities for providers to share more and better information of Guide services that might be offered locally. So we really feel this is a gap that public health could fill, where public education can be disseminated and prioritized in local communities, including the states you'll hear from today, to really help get the word out that Guide is here, Guide is available, and it's a potentially exciting model. And as you can see from this particular slide, the focus of this webinar really fits and aligns with the mission and goals of the Bold Public Health Center of Excellence on Dementia Caregiving. And if you'd like to learn more about our center and its many activities and resources, we encourage you to scan the QR code, or we'll also share information about how to get in touch with us and engage with us at the end of the slides. Next slide, please, Ashley. Some quick logistical notes. Please submit your questions for speakers in the Q&A feature. We'll do our best to get those questions to our wonderful panel here today. You can also use chat to share comments, resources, links, and ideas. We're always excited to hear more about some of your thoughts in this area. The slides, a recording, and resources will also be shared after the event. And finally, please complete the survey at the end of the event. It's going to pop up in Zoom when you leave the webinar. We really benefit from your feedback, and you can see both the QR code and survey link here. Next slide, please. We wanted to start with a poll question. In what capacity are you attending this event? You can see some of the options here on the slide. If you wouldn't mind taking a few seconds to complete the poll, that would be great. And we'll then move ahead. Thank you, everyone, for responding. Looks like we're getting a great response rate here. So great. We have a big proportion of our audience are actually representing community organizations or service providers. We also, as always excited to have bold public health agencies here with us. We also have caregivers and professionals um, as well as individuals living with dementia in our audience. So again, a wide range of perspectives that we're excited to hear more from here today. Next slide, please, Ashley. Wanted to welcome our speakers today. And again, this is really going to be a guided conversation. So our speakers might have some information to share vis-a-vis slides, but this is by no means a lecture. I have some questions to kind of kick things off for our speakers today, and then hopefully we can follow it up with a robust Q&A exchange. Very excited to have Joanna Espinoza Robbins here. She's the ADRD Program Manager in the Colorado Department of Public Health and Environment, as well as Dr. Hilary Lum, a noted expert in dementia care and geriatrics. She's a professor of medicine at the University of Colorado. And we'll be hearing about the efforts specifically in Colorado and working to partner with GUIDE and to disseminate GUIDE. We also have Rochelle Roberts. She's the state dementia director at the Tennessee Department of Health. Again, has led and has been engaged in the very exciting, bold work happening in Tennessee, as well as Phaedra Johnson from Louisiana, who's a healthy communities manager. And you're going to be hearing about a very interesting joint partnership between Tennessee and Louisiana as it relates to the GUIDE model and GUIDE promotion efforts. So thank you all for being here. Ashley, is there another slide? Or are we going into the discussion now? Okay. I wanted to just again reflect briefly on the guide model itself. I think some of you are familiar with this. Some of you, this might be more new information, but the guide model, again, guiding an improved dementia experience, very exciting initiative launched by the Centers for Medicare and Medicaid Services back in July 2024. This model is really designed to test whether a comprehensive package of care coordination and management, support to care partners, as well as respite can improve a range of outcomes, both for people living with dementia and their caregivers themselves. Here you see the core elements that all guide model providers are to offer. Now, many guide model providers will offer this in different ways, which I think we'll get into in some of the speakers' comments. But you can see kind of the core pillars of what the guide model is. Much of this work emerged from many successful clinical trials in collaborative dementia care that have emerged over the past 20 years or so. And that was really the scientific basis for the need to disseminate this model across the country. As of now, and the numbers have varied to some extent, but roughly 400 providers across the U.S. are offering the guide model, again, in different ways, shapes, and forms. Some of them are physical providers. There are many guide model providers that are offering these services remotely. And again, we'll talk a little bit and touch on some of these variations, hopefully, here today. One of the things that have struck me in some of my community outreach efforts here in Minnesota, for example, visiting the different counties in Minnesota to provide education on dementia and also, some of the key breakthroughs that have been happening, not only in diagnosis and treatment, but also in care. The guide model, I would argue, is one of those key milestones that have occurred over the past couple of years. And it always strikes me that really nobody knows what the guide model is. And this isn't just for people living with dementia and care partners. In many cases, it's healthcare professionals and community service providers as well. And I think this is, again, an opportunity for public health to really kind of be at the vanguard of efforts to get the word out and get people connected to this service that we believe can really benefit individuals. And I could go on and on about why I think the guide model is exciting, but I really want to turn to the speakers because they'll have such noted insights into these topics. So I'm going to start with some questions, and I'm going to start with Colorado with Joanna and Hillary, Dr. Lum and Ms. Espinoza. So, Dr. Lum, can you please give us an overview of the guide ecosystem in Colorado, your role and involvement so far? Some details like number of guide systems and providers in Colorado, how your organization is involved, et cetera.
Thank you so much. It's lovely to be here. We're excited to share about Colorado as one example and hope that everyone here looks for what's available in your particular state. So in particular, in Colorado, there are 6 programs that are locally doing outreach and providing the longitudinal dementia care services across the state of Colorado. And it's been helpful that we know of each other because of the Guide Coalition, which Joanna will speak in much more detail about. So the program that we run is out of an academic health system. There is another that's home-based primary care oriented. Three others that are in conjunction with hospice and palliative care organizations. And then the sixth is palliative care social worker led. So a diversity, as mentioned already. The size of the population served, there are a couple different ways to describe that. Our six programs are now in our first or second year of serving individuals with dementia and their caregivers. And we have different amounts of participants in the program. I think it is varying from approximately 50 to 150. So that just gives you a sense of the range. And we're really continually enrolling and seeking to get the word out and helping individuals to know about GUIDE, to see if they are eligible for it. Importantly, we are seeking to serve the whole state. And as we'll get into with some of the specifics, GUIDE really aims to help people live at home in their communities, which really means that GUIDE models, GUIDE participants need to have partnerships with local home care to have respite. That can either be home-based respite or adult day centers or facility-based. And as all of us can likely relate to, that really varies depending on if you live in a city, a suburb, a rural area, or 70% of Colorado counties would be considered frontier. So we are really trying to think about how GUIDE can be available in the communities across Colorado. I think that there are a number of challenges that we can get into, and I hope that questions will come up. I think that we are really seeking to have individuals be able to find us as a GUIDE program, and we're looking to share enough about GUIDE so that individuals can see if GUIDE is a good fit for them, to think about, are they motivated to participate in the monthly longitudinal outreach calls, and also then have that benefit of being connected from clinical to community resources. So we're also on a learning curve of learning what community resources exist. So I would say from the perspective in the healthcare system, it is so helpful to be in forums like this that always encourage me to be able to learn more about who aging service providers are in our local communities, so that our GUIDE program can really be making good recommendations for clinical to community partnerships.
So, Hillary, I'm going to be interspersing some of our pre-prepared questions with some that are from the audience, and I thought this was a good one from Kathy Glazer. She was wondering, to be clear, are you referencing state providers and not national virtual providers in some of your comments?
Yeah, so the six that I mentioned that are part of our coalition are our local state based in Colorado. And we are certainly learning and communicating with virtual providers. And I would say that that is an important area to have communication and coordination about. I don't actually know all of the virtual providers who can serve individuals in Colorado. We're working to build that knowledge for us locally here in Colorado.
Yeah, that's interesting. One of the things I've tried to do is when I go and give my community talks to, again, communities about GUIDE, I've tried to put a slide together of what are the available providers for Minnesota. And kind of like Kathy is alluding to in her question, it was a real mix. I mean, there certainly are national providers. And if you go on the CMS website and that big Excel spreadsheet they have, it'll indicate where the providers are practicing or where they're seeing people from. And there are quite a few of these virtual, I would assume, virtual providers that can offer services, in this case for Minnesotans, that they're not physically located in Minnesota. One thing I will say, this is such a heterogeneous program, even though there are some of these core pillars. how this will be evaluated and how we'll understand the actual benefits of the program. That it will be a challenge because you're talking about a great deal of diversity and delivery and a whole number of other factors. So it's very exciting and also very intriguing once we start understanding more about for whom and how this is working and working well. So
One thing I'll just add, because there may be individuals, so this is the first time they're hearing about GUIDE. Think of GUIDE as you can only be part of one GUIDE program at a time. There may be a misconception that anyone who offers GUIDE, that a person with a diagnosis and their caregivers can just readily switch. Um, and that's not how it's set up. Medicare has instead set it up more similar to hospice. If you are enrolled in hospice, you're enrolled
yeah,
with one community organization.
yeah.
Um, because it's confusing, and individuals may find that they want to shift to a different GUIDE program, which absolutely is possible, but you can only be in one GUIDE program at a time.
Yeah, that's great. Thank you, Dr. Lum. Great comments. I mean, we're getting some really great questions and comments here. I would love to treat them more in depth, but we also want to continue on with some of our other excellent panelists here today. And I'm going to turn to Joanna. So Joanna, let's talk about the role of your public health program in the local guide ecosystem in Colorado. How'd you come to engage with guide providers and why? And what have been the ways in which your public health program has supported the local implementation of guide?
Yeah, thanks, Dr. Gogler. So I think for us in Colorado, this collaboration was really born out of our Alzheimer's Disease and Related Dementias Action Coalition and Colorado ADRD State Plan. We knew of GUIDE when the first providers were funded in Colorado in 2024, and at the time had worked to develop along with some members of our coalition, including Dr. Lum, to develop a flyer so that we could educate folks in Colorado about this resource. We have an activity in our state plan around convening healthcare providers and public health to share best practices. And we had been brainstorming over the last couple of years about the best way to implement that. And one of the thoughts, which Dr. Lum was instrumental in this convening too, was we could leverage guide programs in Colorado to fulfill this activity as a way of getting public health connected with these providers who are in the delivery of dementia care to share best practices. And so that's kind of how it was born. There was an initial convening in the spring of last year. We invited them to our biannual Action Coalition meeting and then started the convenings in the fall for the Guide Action Coalition. Not Action Coalition, just Guide, Colorado Guide Coalition. And this has been really great. It's a really nice space for guide providers to be able to share successes and challenges among each other in guide implementation in Colorado that can help them be more successful. And it allows us as public health be able to understand their barriers and where we can provide support and be a little bit more, be able to react more quickly to the needs that they may have. One of the ways that we have supported them is in the development of a Colorado map that maps the 6 local guide providers in Colorado, addressing the need that many healthcare providers and patients did not know where to find, like which guide provider served their county or community. And we knew from guide providers that though CMS has this information, it's not readily available. Thank you, and Elma is sharing this in the chat. So we have gone through some iterations and I think are in a final place with the map where we can start disseminating it broadly. So I think that has been a really great resource that has come out of this collaboration. Also, as public health professionals, it fits well within our role to educate our partners and the public on existing best practices. And so Guide has very much become a part of this. We've done that through the flyer that we've developed, which we share with partners and presentations. We were able to integrate education about Guide into our dementia webpage ahead of the launch of our public awareness campaign last year. So that got a lot of traction and hopefully a lot of members of the public were able to learn about Guide in that way. We leveraged opportunity in key informant interviews with primary care providers and care navigators last year to educate them about GUIDE as a resource too. So we're able to just integrate this into a lot of the efforts that we have. We've also been working on a centralized repository of resources in Colorado, and we do that through Mile High United Way 211 and have added a spot for GUIDE there as well.
Well, that's great, Joanna. Thank you. And again, I kind of see the efforts of Colorado as a leader in this space, and certainly in Tennessee and Louisiana too, which we're going to hear from shortly. Again, a lot of great comments and questions coming through here. I'm noticing both in the chat and the Q&A. And Adria Navarro has a great point here. As a resource specialist, I see 4 active guide programs in my county, but families are challenged to decide which one to reach out to. I see such differences in how they deliver services, and I think it's just a key point to bring up. It's aligned, I think, with some of my comments earlier about the diversity of what's being offered. And in the end, if we're trying to match people who could benefit from these services, knowing about this diversity and understanding for whom these different types of approaches work best, it's an open question. I don't think anyone has a great answer for that. Eugene Barrows also he raised a really great point, and I'm not sure any of us can answer it yet, but it's something I've thought about is, do we know if any guide providers have dropped out following its launch in July 2024? Do we know any details about that? Eugene, I think CMS is probably the best holder of that information beyond what some of us might know more locally. I've anecdotally heard some potential guide providers have stopped, but I just don't have any. I don't have any actual data to that effect. I don't know, Hillary, if you have heard, or Joanne or anybody else, but that's been my experience so far. But
Not
it's all
that I'm,
anecdotal. I have to stress it's anecdotal. I don't have any access
yeah.
data, so yeah.
Not in Colorado. We had 3 guide providers that were funded in the first year and 3 this year. So far, all 6 that we know of are still here.
Yeah, that's great. And another resource I wanted to point out to everyone, I see we have Jane Carmody here from John A. Hartford Foundation. And again, a great resource that we've promoted ad nauseum through our center is Best Programs for Caregiving. And they have a nice community connection for Guide there. Jane has shared the website in the chat, bpc.caregiver.org. Again, a great resource. And Jane, it's great to hear that Best Programs for Caregiving is trying to serve as that connector for Guide, which is really needed. So thank you. Thank you, Joanna. Thank you, Hillary. Do I have some more questions here? I think so here. So we're going to turn to Dr. Lum. As a clinical service provider, what opportunities do you see in collaborating with public health in the context of Guide?
Yeah, thanks. And I think I can pick up on also some of the comments in the chat in terms of like how actually does this community connection work, and are we assessing for health related social needs and then connecting from the healthcare system perspective. So I think that it is very much important from the Guide perspective to do a thorough ongoing assessment of what is needed for safety, support, social engagement for the person and their caregiver in their community. And then it really is up to the navigator to brainstorm and tailor resources. And they can only do that based on the resources that they've heard about or know about. And we want our care navigators to be very in touch with the local or national resources that might be a good fit for people enrolled in Guide. And so public health and our collaborations are a key piece of this. Joanna mentioned the Colorado 211 website, and that is a public space that our navigators are familiar with and can even connect family caregivers to that space, because we also want to really be increasing the self-efficacy and the tools in the toolbox that our caregivers have to also do their exploration. So having the opportunity to have connection and collected resources from public health to share out what's available to us on the clinical side has been really important. I think I also wanted to mention this aspect of wayfinding, how even to pick which guide program. So that came up as a question. That's another key place for public health. I, as a one of 6 programs can tell you about the specifics of our program and what it would look like if someone was a member of our program. And I know a little bit about the others because we communicate and seek to coordinate. However, I love that our Colorado State program is thinking about a centralized website and even thinking about ways that we can provide some non-urgent support, some Q&A, perhaps through a centralized email, so that if people are wondering, like, which guide program should I pick, or I'm having trouble reaching a guide program, from a public health perspective, we want a place like a front door that individuals can then find information about different guide programs. You are on mute.
Sorry about that. Yeah, I was typing some responses here. I didn't want people to hear my keyboard, but yeah, thank you, Dr. Lum. Clearly, that addresses some of the questions coming up in the chat and the Q&A, and I'm getting a lot of chat responses on the extent of providers who did drop out. And again, this is why it's so great to have these webinars. There's so many great sources of information. Bill Zagorski, he mentioned around 50 providers who were awarded guide contracts either opted out or did not proceed with the launch. Most of those were considered the new organization cohort. So they were selected to kind of build the infrastructure for a year and then offer guide. There's probably a lot of reasons as to why that occurred. Hopefully, there'll be some studies to understand why that occurred. So right now, there's around 350 active providers. So that's a great. Those are great points there. I wanted to ask both Joanna and Dr. Lum, Ms. Espinoza and Dr. Lum, some final thoughts on and about guide in Colorado, and then we'll move to Tennessee and Louisiana. But for both of your perspectives, what's on the horizon, and what are some opportunities you see from both the public health and clinical provider perspective for guide, not only in Colorado but beyond?
I can speak a bit to the upcoming collaboration, and we're so excited to be able to have this space to communicate with guide providers and work in this way. Dr. Lum already mentioned one of them is we just talked about this at our last Guide Coalition meeting, is developing a web page where we can educate folks about what guide is, who the different guide providers are, and more information about them so that someone can make a decision of which guide provider is right for me based on each individual provider and the service area. I had also mentioned 211. One other way that we're working with guide providers is because they're already in this space of community clinical linkages and in connecting folks to resources, is working with them more directly to enhance that repository with resources that they're already connecting their community members to. Again, just continuing to contribute to this centralized repository for Colorado. We are additionally working with one guide provider to pilot and develop this workflow for how guide can serve in being this mechanism for community clinical linkages for folks who call in who are not guide eligible. They get a lot of these calls and they're already generating some of these connections. So maybe there can be a better way to do this and still provide these important connections for folks who maybe have an Advantage plan or there's a reason for why they don't qualify for the guide services. And then a couple of other things. We had engaged guide providers on this topic, and as a result of the coalition, one of our members from the Alzheimer's Association is hoping to lead a care navigator support group and learning collaborative this year. This very much came up as a need for guide providers with their care navigators facing burnout and seeking that space to be able to connect and talk about their resources that they may need. And then lastly, we recently were awarded funding from the Next 50 Foundation, which we applied to do a project that we call DREAM, the Dementia Respite Education and Access Model, where we are looking to, in Colorado, develop dementia-capable respite criteria for respite providers. And we're looking to engage guide providers in being part of this coalition and helping develop that criteria. So I'll leave that there and see what Dr. Lum has to add.
I'm really excited about these opportunities and especially seeing how we can be engaging home care companies. I saw that in the chat also, and offering at the state level opportunities for dementia specific training for their team members. And so I think that we're, as guide participants, really leaning into public health opportunities because public health will have more reach than any one guide program will.
This is great. Thank you so much, Dr. Lum, Ms. Espinosa. One thing I would hope is for both of you, if you have time, as well as any of the other speakers, feel free to respond to some of these great questions and comments that are coming in. They're really, really good. We're not going to have time to get to all of them. I wish we did because some of these are really excellent. And as time permits, I'll try to redirect to that. But we wanted to have time to hear more from Tennessee and Louisiana, who were so thrilled they are here, Rochelle and Phaedra. Love to hear you talk about the role of your respective public health programs in the local guide ecosystem in both Tennessee and Louisiana. How did you come to engage with the guide providers and why? And what have been the ways in which your public health programs have supported local implementation of guide?
So I'll speak for Tennessee. TDH, or Tennessee Department of Health, proactively reached out to our Tennessee guide recipients early in the implementation phase. One recipient that we spoke to actually remarked that we're impressed. We've never had a public health office reach out to us. This is fantastic. So the subsequent relationship building really highlighted a clear gap. There's limited state level connection and then barriers navigating the non-clinical supports like we've discussed already. So we intentionally position public health as a partner and a connector and a problem solver, not an overseer, not a payer or provider. So these early conversations really supported that bidirectional learning from the guide recipients to us as well. And the guide recipients really shared early on their pain points like referral uncertainty, limited respite capacity, early successes that they were seeing, and ways that they've found to support families who don't qualify for the traditional guide model to still offer those services to them, and then planned service areas at the zip code level. So again, TDH, our public health, was really that neutral convening power. And we were able to support statewide visibility through resource development. We have a map very similar to Colorado's, and it's broken down by zip code, and it has the providers that are each working in those areas, along with a caregiver toolkit. And so it's just identifying if you're a caregiver, identifying what respite is, and then who our guide recipients are in Tennessee. So, and then the main priority goal of our coalition is really connecting the guide recipients to state resources. So our AAADs, our respite associations, our faith-based and religious support, and then offer access to our workforce training. So through our Tennessee Dementia Echo, which trains providers and public health staff, and then Tennessee Train Repository.
Yeah, so just to echo a lot of what Rochelle said, so as a public health department, we understand the importance of public health in partnering with our guide sites, especially for the development of community clinical linkages. And so guide sites as health systems are responsible for coordinating with those community-based organizations. And we figure we can come in and help leverage those partnerships that we've developed as bold grantees and just as a health department to help them make those connections to those services. And also as bold grant recipients, we understand that, we're working to improve dementia care coordination and caregiver support across our states. So engaging with an innovative model such as Guide was really a no-brainer to us and such a win. And again, as public health, we have experience with convening our multiple coalitions and councils and just a knowledge of statewide resources. So we figured, working with our Guide partners, we could help them do that as well. And particularly in Louisiana, a few of our guide providers are actually longstanding partners of our statewide ADRD coalition. So we already had these relationships established, and they were the first to be on board to join this learning collaborative. And with the others, we worked to reach out to them and let them know, like, as a public health partner, that we're trying to fill the gap. We're trying to provide technical assistance in any way that we can as they began implementation of the model. So we started the Learning Collaborative, invited our partners And then since then, we've continued to promote the guide model to our state coalition, to our advisory council, which consists of providers, primary care providers, and other risk factor providers, as well as community-based organizations. And we also do that directly with our primary care providers through our Healthy Aging and ADRD Project ECHO. So we'll have a series or a session coming up soon focused on the guide model just to provide more information about what services are offered and direct referral pathways for those providers. And much like Tennessee and Colorado, we have entered our guide sites into our community resource repository for Wellhead, Louisiana. That also has a mapping feature, not quite by zip code, but it's available for residents to see what services are out there for guide. And we're currently working to develop a flyer as well as update our webpage to highlight guide and all of those participating systems.
Great. Thank you both. Very exciting work as always, from your respective states. I wanted to turn to a few of the questions that have come out in chat, and I think one is really critical. Again, from Eugene Barrows, how can public health organizations ensure guides accessible to diverse populations, including non-English speakers or those with low health literacy? I'd love to hear your thoughts on this.
Yeah, so we have been invited to a couple different tables to do presentations. Just most recently, we talked to our Health Disparities Advisory Council. It went over very well, provided high-level overview of guide and all of the resources that they could want, and then had conversations just about what advocacy looked like, how to promote this in their communities, in their churches. And really pushing this out and making this more accessible. But I think it's just being cognizant that your materials need to be accessible to the population that we're trying to reach. One size doesn't fit all in this case, and let's make it as easy as possible to navigate.
Yeah. And I think the flip side of that, Rochelle, and again, this is where partnerships such as yours and in Colorado are so critical, is yes, we want to provide materials and other information that can reach all communities that could benefit from guide, non-English speaking, those with low health literacy, et cetera. The flip side is we have to ensure that the guide model providers are set up to adequately serve those individuals and families. And that's where I think these partnerships are so critical, is that certainly from a public health perspective, you can likely have a better sense as, there might be certain providers that are better suited than others to meet the needs of these various types of communities, whether they be rural, non-English speaking, immigrant, whatever those different, all those variations are. Yeah, I mean, I think that's another area where our public health can really help advance the dissemination of guide and hopefully eventually its effectiveness, quite frankly. So great. Thank you, everybody. Another question that was brought up is, can community health workers be effectively trained to support CMS guide promotion? If I may take the liberty to answer that question, I would say yes, they certainly can. I would almost argue they should, related to that prior question. Secondly, I think community health workers not only can promote guide, they can deliver guide through the care navigation element of the guide model and perhaps even some of the other elements. So, and one could make the argument, in fact, that might enhance flexibility as well as outreach to some of these various communities we just talked about. So again, great questions and comments here from the audience. So moving on, Phaedra and Rochelle, tell us more about your two-state coalition, Guiding States Learning Collaborative. How did it come to be? And again, how has it worked with the guide ecosystem in your states?
Yes, I can get us started on that. So in Louisiana, we have 4 brick and mortar sites, as well as 3 virtual. And in Tennessee, 8 brick and mortar, 6 virtual. So just learning about this model, we were both very excited about, the opportunities that were coming to both of our states. And so we actually connected through our regional health systems director of the Alzheimer's Association, both understanding that we had this new innovative model in the states and wanted to see how we could connect more with these participating systems. And so we also saw that we had some virtual providers that were serving both states, and we really wanted to come together again, not wanting to duplicate efforts, but join forces and really have a space for resource and knowledge sharing. So we kind of followed the Dementia Care Coordination Roundtable in Virginia, modeled that, and really just designed a peer-driven network for our Tennessee and Louisiana-based guide recipients. We do have a few collaborative goals, which are just basically knowledge sharing, capacity building, and scaling impact. And really just wanted to bring these participating sites together because we heard from the participating sites that CMS wasn't offering this platform for connection. They weren't offering anything for technical assistance. So we decided to create this really to just have a space for learning and sharing more about these community-based services and strengthen our referral networks.
Great. You know, a question came up in chat, and I think, Rochelle, given the work that I'm aware of in Tennessee, you'd be kind of well positioned to answer this. Any best practices and successes engaging faith-based organizations and spreading the availability of the guide model?
Yeah, so we are uniquely positioned in this arena. We've been partnering with the University of Tennessee Chattanooga School of Nursing, and they've been facilitating engaging communities, and they've been working with faith leaders for the last few years. I think we're at 4 years now working in that space. So they've been training over that period of time congregations to be more dementia friendly and age aware and inclusive in their practices. And they just rolled out as of January the Age Friendly Congregation Certificate Program. So now officially training and recognizing these congregations as age friendly and supporting the development of respite services that meet the recommendations for the state. So again, it's slightly unique space for us when it comes to that. But I think other ways, there's multiple sectors within the government that address faith-based communities. And so I would say tap into those resources and get in front of them as much as possible and just build those relationships. But it takes that time to build relationships with our faith communities. But once you do, they are that trusted resource. And so we see great profit in that space.
Okay, great, thank you. So Phaedra, Rochelle, we know, it's noted you don't have a provider counterpart here today, but what have you been hearing from guide providers about what they see as benefits of being part of your coalition?
Yeah, I think Phaedra kind of touched on it. I think it's the value of having those state level partners and a peer learning space. Our very first session, it was great to have everybody on that call, and all of a sudden people started chiming in and they said high tides raise all ships, and that just stuck with me from that conversation on, because yes, we have our guide recipients that are out there to profit in this space, but we have enough people that need these resources. We have caregivers that have high burden. We're not fighting over the same patients. So to be there and to pick each other up and to build those relationships and understand if they are outside of my zip code range, I know who to refer them to, and I can be a referral partner within our guide recipient network. So I think that's probably one of the biggest outcomes. I had one quote written down from one of the other calls, and it's a shortcut to understanding the system. I also do have a little quote from Tempo Health. And so they've been tracking various metrics, which every guide recipient has to do. But they demonstrated a 36% reduction in total cost of care, 75% reduction in ER transfers, 96% monthly program engagement. And so a quote from one of the family members was, "From dealing with paperwork to coordinating with other clinicians to offering personalized strategies for managing dementia, Tempo empowered us and made us realize that we're not alone." And so I think that's
Well, but the results you're sharing, Rochelle, that's from the Tembo product itself. Is it from Tembo in terms of the work they're doing as a guide model provider? Because I would imagine they can't have that data available this soon.
Some people have been able to be up and running, seeing patients earlier.
Yeah.
They were one of those.
Yeah.
So they do have some information in that space. But
yeah, I mean, I don't mean to sound skeptical, everyone, but Tembo is one of, I believe, the remote providers, right? They're remote providers, is when statistics like that, which sound pretty overwhelming based on what we know about dementia care interventions and best practice, is to get a better sense of where those results coming from and where have they been published and disseminated. Not questioning the quality of the model. I'm sure it's a wonderful program, but at the same time, I think this is important for us as public health professionals is to sometimes dig a little deeper in those types of statements and results, everybody. Okay. All right. But otherwise, that's great, Rochelle. Thank you. And again, the work that Tennessee and Louisiana has been doing has been incredible. And I was hoping we could conclude about what are some of the challenges your coalition has identified and what are some of your plans or next steps?
Yeah. So respite access continues to remain a challenge. So we have, insufficient number of respite locations, those geographic gaps we're seeing, especially in the rural areas of Tennessee. So in Tennessee, we continue the storytelling to show caregiver burnout and concerns and barriers they're facing. We're incorporating those storytellings into the Tennessee multi-sector plan for aging data dashboard. It's our version 2, so it's an expansion. And there's a new link. It's called Beyond the Numbers, Aging in Tennessee. And we were able to have 12 focus groups. So I think taking the information from Guide, taking information from the data and the qualitative and quantitative data that we have is that storytelling piece. We're also drafting a funding proposal to increase respite locations in Tennessee, and that should be out in the next few months. And implementing, again, the age-friendly congregation certificate facilitated by UTC.
Great. Phaedra, did you want to add a little bit?
Yeah, so in our last Learning Collaborative meeting, we actually spoke about that age-friendly congregation certificate as well as the Alter Dementia program.
Yep.
So just together, we'll continue to educate our guide sites on other community-based options for respite. So with the Alter program, they are inspiring and equipping predominantly African American faith communities to become dementia-friendly. So by partnering with Alter, congregations are building awareness in their communities through different initiatives, and one of those is respite. So we just want to, make the guide sites aware that churches
Yeah.
are a source for respite where access may otherwise be limited, such in rural areas.
That's a great point. What a wonderful point. And everyone, again, Dr. Epps is a member of our executive committee on our center. I think we've done multiple webinars on public health engagement with faith-based organizations or in the space of dementia care, and Alter, as one could imagine, is a leading aspect of that, as well as work in other parts of the country, like Tennessee, for example, and their great work with faith-based organizations. So that's such a great point to make. So, um, one of the questions I'd like to pose, and I think we're at the point we can probably just address some of these Q&A and chat comments and stuff. And I thought this was a really great question that was raised in the chat, is how can public health organizations measure improvements in Medicare beneficiaries' understanding and use of Guide? Don't know if any of our panelists have thoughts. I think or even those in the audience. I think it's a really great question.
Yeah, so I think we have to give it a couple years to be fully up and running before we can take these numbers and kind of run with it, like it was said earlier. But we do collect Medicare information, and we incorporate that into our data dashboard. So we're looking at how to kind of build that picture out of where the guide recipients are, what we're seeing as results. You can do chronic condition overlays, so we can talk about risk reduction just in general. But I think just giving them a little bit of time to be up and going. But that's kind of how we plan to use data in the future.
Great. Yeah, I think there's much to know, and hopefully, through the CMS guide model, for those that don't know, 3 large national contracts were given out to organizations, one to assist with implementation of the guide model. The other, I think, focused on training. I know Dr. Epstein Lubo is in the audience. He may want to comment on this too. The third is actually evaluation. And so I would imagine as time goes on, we're going to start seeing some preliminary data and insights as far as how the guide model's been working, maybe in some ways, in ways that hasn't, et cetera. So I think that's going to be pretty interesting. And This is more my own comment, and I'd love to hear what all of you think is, I notice in the chat people are finding this very informative, and they're finding that some local providers exist that are offering guide in their own areas. For example, I think Grace has mentioned she found that OU Health in Oklahoma City has a guide program which was launched in 2024. You've heard me comment in Minnesota, and I think what's so inspiring of the work in Colorado and then Tennessee and Louisiana is you're taking the next step to create not only coalitions, but hopefully public health information that people can use. And I know, we're hoping to do something similar in Minnesota. I mean, you might have sensed some of my frustration when I'm out in the community, and I can't, the obvious question people are going to ask is, wow, this is a great sounding program. How can I use it? And I'm kind of left with a slide that has maybe semi-useful information for people to access. And I'm hoping all of you, we can see, you can use Colorado and Tennessee, Louisiana as examples for how public health can work to make that information more actionable. And I think that's why this has been so exciting to me. A couple of other points that were brought up, I'd love to hear any reflections from our panelists, but Kathy Glazer had mentioned we have a number of home care providers doing a lot of outreach and publicity about Guide via virtual national providers saying they keep all their local providers. This has caused many challenges for caregivers. Some other challenges mentioned were some of the siloing that happens, for example, in academic health centers that make it hard to deliver Guide. So I think these are some interesting points too. Another really interesting question, and again, I don't know if there's an answer to it, is uh, how will Medicare Advantage be involved with guide model provision? Is there any thought of it? Is there any thought of Medicare Advantage positioning to offer guide? I don't know if any of you have heard anything in your states to that effect. Yeah, and maybe the more accurate question is, does Medicare Advantage want to go into guide? I mean, I guess if they see value in it, maybe they'll position and move in that space, but otherwise unknown. So, other questions that have come up here. Are any guide programs planning to expand into new CMS payment models, such as the CMS Access model focused on tech solutions for chronic care? I don't know if any of you have any answers. I don't know, Dr. Lum, Hillary, if you've heard anything to this effect.
I don't know about that specifically. I think going back to the theme about community health workers and Medicare Advantage, and just in general, seeking to be creative with the existing payment mechanisms that we have, our team has been thinking about principal illness navigation, which is not dementia specific and does exist as codes. So community health workers could potentially be involved in partnering with a clinical team to have principal illness navigation, to have the navigator part of guide, which I really think is a key component of the guide model.
Wonderful. Thank you, Dr. Lum. Another key question that came up here by Jacob is, can you describe more how public health is helping guide providers and assisting individuals who are not eligible for the guide model? And maybe if we don't have an answer, it's a question we should try to answer, but I'd love to hear what you all think here.
I can
So, go ahead.
Go ahead, Rochelle.
Okay. So in Tennessee, we've uncovered that there are organizations that can offer guide-like services to patients that don't qualify for the traditional guide model, like we had said. So I think it's just uncovering those and having those conversations, again, building those relationships to know where to send your person who needs these services. But we are also leveraging our Tennessee Dementia Navigators, which we'll be expanding to with our Rural Health Transformation Funds. So we'll soon be hiring 27 additional navigators. So they are able to kind of take those individuals in and do that wraparound service. Can't offer the compensation for respite for that caregiver, but they work with that caregiver and patient dyad. So that's incredibly important to us. We also have a coalition that does offer some financial support with respite, but we're looking at other options.
In
Okay.
Louisiana, just want to add that actually a few of our guide sites are offering caregiver support groups and caregiver education sessions to everyone. So not just limited to those that are eligible for guide, but making that available to anyone that needs it.
Great. And Rochelle, I think you had mentioned about the age-friendly certificate program. I believe it was for faith-based organizations. question came, can you post the school that is doing the age-friendly certificate program, or who's offering that, I guess?
Yeah, yeah, I can do that. Oh, Elma just did it. So it's UT Chattanooga School of
Ah,
Nursing.
perfect. Thank you,
Yeah.
Alma. Wonderful. Thank you. A couple other follow-up points in chat. Again, so glad to have people that can answer some of these questions. Bill Zagorski has mentioned many of the national virtual guide recipients are indeed working with Medicare Advantage plans and designing quote unquote guide light plans, which include the clinical and caregiver support aspects, but not the respite. That raises the question, are you really then offering the model as it's intended to be offered? I think all of us believe the respite piece is pretty essential. So I think that's kind of an interesting point there. Um, I'm going to turn it to the panelists. Well, here's one final point I want to bring up. Everyone, please, bear with me. There are so many great comments in here. It's hard for me to pick out the ones I want to highlight. But again, this is more of an issue, and it's maybe something that we all maybe would want to strive to get to, and perhaps Colorado and Tennessee and Louisiana have gotten there already. But Tiffany mentions, as a local nonprofit with a community resource guide, we are trying to educate caregivers on how to access guide without only giving them one or two subcontractors, but with an easy step-by-step process with a way to connect the overarching guide providers. How can we do that without just sending caregivers to a guide provider's website? Is there an example of others have done this? How can we make it easy to help caregivers connect? Maybe an example of a website or directories for caregivers, exact phone numbers. I think what Tiffany's getting at, is there a way to go move beyond, the info at email address or the 1-800 number or even a web link and try to ensure better connections for caregivers and others to guide sites? I don't know if your states have insights to that.
I would say that really is at the heart of what we're talking about today, that because there is not yet this one size fits all to reach all in every language and knowing every resource, that the knowledge sharing that Phaedra mentioned is so critical, so that as I reach out, say to our AAA partner, Denver Regional Council of Governments, their care manager, who is in touch with lots of people, would know reliable information about guide. So it is absolutely aspirational. I think we should all keep working on that. And it's so exciting to see like nearly 200 of us here learning about guide, thinking about then how we can find our reliable partners and talk about it so that I learn something new about guide in our community every day. And because we've now been at this for almost 2 years, I'm hearing the misperceptions. Like there's a
Mm,
lot of incorrect information because the model is pretty complex.
yeah, no, that's great. Great comments there, as always, Dr. Lum. Any other final comments, Rochelle, Phaedra, Joanna, you'd like to make before we conclude today?
If anybody had an example of an intake, so Tiffany's actually from Tennessee and kind of spurred on the question I was going to ask, but is there a basic uh, referral form that could be filled out to prepare the caregiver prior to making the call, just to understand some of the
Yeah,
basic information?
yeah.
So if there's any copies that you guys have available, would love to be able to review that.
Well, that certainly could be something that many bold providers could perhaps work on as part of their work to try to, enhance and facilitate that connection. That's a great point, Rochelle. Anything else, Phaedra, Joanna, you wanted to share with us here? I think I have one final slide to put up, some final housekeeping notes. Otherwise, yep. Phaedra, Joanna, anything else you'd like to share?
Just want to speak very quickly on the misperceptions of the guide model.
Mhm.
I think we as public health and just other community-based organizations have to really lean into our role of spreading awareness about the model and just all the benefits, especially advocating for primary care providers to
Mm.
refer their patients. Just understanding that we're not pulling their patients away from them, but offering additional services for that person living with dementia and their caregivers.
Thank you, Phaedra, so much. Appreciate it. And certainly appreciated your comments throughout the presentation here, Joanna, and all our panelists. We're just scratching the surface on the many great questions and topics that have been raised here in the chat and the Q&A. But I will say, if you'd like to find today's slides and recordings, please visit us at bolddementiacaregiving.org. That's the Bold Public Health Center of Excellence and Dementia Caregiving website. If you have other questions, if you'd like to review some of the other resources and materials we've compiled in this area related to GUIDE, as well as many other key initiatives, again, we encourage you to visit us and certainly follow us on social media. Follow me on LinkedIn. You'll be kept up to date with everything. So, panelists, thank you for the wonderful webinar. Again, the work you're doing in your states, again, is truly inspirational, as so many are saying in the chat. I certainly believe that. I think public health has a key role to play in ensuring GUIDE's model successful dissemination and overall public health benefit. And thank you for your work and being leaders in this space. We really appreciate your time today. And thank you, all the great attendees, the great questions and comments. Again, reach out to us if there's anything we can do. Appreciate it.